It's very gratifying that the Thai community is being represented here, because oftentimes we're overlooked. Instead of a model minority, oftentimes the Thai community feel like we're a minor minority and not represented in any policy making. And so we really truly appreciate this. Thai immigrants, I'm an immigrant myself, raised here in Los Angeles, and Thai immigrants have made their home here in Southern California since the 50s, while compared to other ethnic immigrants in the API community, we're fairly recent. We are growing steadily, about 23–25% every census, and we have right now about 200,000 Thais in Southern California, and that's the largest population of Thais abroad outside of Thailand. Now, of these 200,000 Thais, unfortunately, 50% of them are undocumented, and majority of them are low-wage workers. They're economically disadvantaged, and their average income for a household of four is about $24,000. And sadly, they're disproportionately affected by the scourge and heinous crime of human trafficking here in the US. We represent the largest group of Asian Pacific Islanders who are trafficked here in the US. And 69% are medically indigent. And the second cause of death for Thais, believe it or not, is peptic ulcer, which you don't die from normally, and you have doctors here who would know that, right? And that's because they are suffering from chronic illnesses and diseases that are going untreated. And then when we talk about the broader definition of health, we also have to recognize that the difficulties of integrating into a new country makes your state of health also very precarious, because Thai immigrants, like many newcomers, are also faced with cultural dislocation and displacement that causes a lot of stress and tension in the Thai households. And that has led, in our experience, led to family violence in the home and disintegration of families. And so when we talk about healthcare for Thais, it's really healthcare on the margins. We're talking about a precarious state of health. We have Thais who are undocumented that our community center have been able to get assistance from who, if they live in LA County, can qualify for the My Health LA program, which at least provides them access to care. We are also a covered California enrollment agency. After Obamacare passed, of course, we got the California version of Obamacare, and that has managed to provide them access to some form of health care at low cost. But as I stated, most of the Thais that we work with are low-wage workers. And unfortunately, we have a system in this country where healthcare is tied to employment. And you could bet that many of these low-wage workers are not getting health insurance because, unfortunately, they're working in a workplace where they are not even being paid basic minimum wage. They're paid below minimum wage and not compensated for overtime, and and they do not receive any other benefits. And healthcare is one of those benefits that they definitely do not receive. So I guess what I want to really try to push for is this healthcare for all that we're all trying to push for, and make sure that we all see this as a moral imperative. Where I really appreciate the beginning, the presentation where healthcare was broadly defined, because we also have in the Thai immigrant community, a lot of housing insecure. And when you are housing insecure, when you are without access to health care, you are completely in a very precarious situation. And then there's the precarity of the coronavirus pandemic on top of that too. So